आवाज़े आगही, वॉइस ऑफ अवेयरनेस।
ये प्रोग्राम पाकिस्तान रेड क्रेसेंट सोसाइटी और इंटरनेशनल फेडरेशन ऑफ रेड क्रॉस रेड क्रेसेंट सोसाइटी की तावन से पेश किया जा रहा है।
इस प्रोग्राम के जरिए आपको मुख्तलिफ मालूमात फराहम की जाएंगी, उन मसाइल पर रोशनी डाली जाएगी जो आपको दरपेश हैं, जिनके बारे में आप आगही चाहते हैं,
और आपको ऐसी तदाबीर के बारे में बताएंगे जिसके अंदर आप अपनी जिंदगी को बेहतर बना सकते हैं और इन सूरत हाल में अपने और अपने घर वालों का बचाव कर सकते हैं।
आवाज़े आगही, जिसका ताल्लुक हम सब से है।
In a disaster, information can be as valuable as water, food or shelter. When more than 20 million people in Pakistan were affected by the worst floods in the country's history in late July 2010, the Pakistan Red Crescent Society, with support from the International Federation of the Red Cross and Red Crescent Societies, began to offer services to help people address their immediate needs and face the longer-term task of returning home and rebuilding their lives. The focus of these efforts centered on Sindh and Punjab provinces, where 75% of those affected by the floods live. The emergency relief supplies were delivered. A process was started whereby PRCS staff and volunteers would communicate with people who had been affected by the floods about the services available to them, including how to assess them. The Red Cross Red Crescent provided people with simple but life-saving information. A variety of mediums were utilized, such as the television, radio, print, SMS, and face-to-face conversations with the PRCS network of volunteers that spans the country.
The program was carefully developed, taking into consideration flood-affected communities' access to communication devices. In some flood-affected areas, people had much better access to communication devices, while in others, they faced extreme information deprivation. There were also particular issues surrounding gender inequality, as women generally had less access to communication tools. Monitoring indicates that most effective communication appears to be face-to-face interaction, making Red Cross Red Crescent volunteer network an important part of programming. Face-to-face communication supplement radio and television programs to reach those affected by disasters. During the pilot phase of our program, we have learned that if we really want to have an impact at the local level, we have to engage the communication mechanisms that are already exist in the community, including the local language and dialect. These will play important roles as sources of information and impact greatly the ability to deliver messages. As we move into the recovery phase of programming, we are using these lessons learned to redesign the beneficiary communication program.
Communication touched on critical issues affecting beneficiaries, ranging from shelter, water and sanitation, health and livelihoods, to obtaining relief supplies such as blankets, food and medicines. Volunteer model was used in PRCS to run the programs and lessons learned from the program. Radio was another effective medium to communicate with the beneficiaries.
During the relief phase, radio proved to be a valuable tool in our efforts to communicate with those affected by flooding. For more than 3 months, radio programs were broadcasted in major cities that were affected by floods in Pakistan, which includes KPK, Sindh and Punjab. For now, we are working on the radio programs that will be delivered in local languages, which is Punjabi and Sindhi. For these programs, interns were selected, after which they were given capacity building trainings for the best output. Through these radio programs, we were able to take live phone calls and text messages from the listeners on the issues affecting them and respond to them with expert answers on the spot.
जान पाते हैं सैलाब से मुतासरा लोगों के मसाइल और इनके लिए PRCS और दूसरी ऑर्गेनाइजेशंस क्या खिदमत दे रही हैं?
Beneficiary communication is entirely beneficiary-based initiative introduced by the Red Cross Red Crescent movement, focusing on the issues, concerns and priorities of the flood-affected communities, which not only include one group of the society, instead the apprehensions of men, women, children and old-age citizens who are surely affected. This project is indeed accompanied by confident expectations of its fulfillment for the betterment of community. So examine what is being said, and not who speaks, but for whom it is about.